Assalamualaikum, Madam Rafiza and everyone. My name is Nur Aisha Tobi. Today, my group and I will be presenting on psychological hazard in occupational safety and health with a focus on the Malaysian public sector. Traditionally, OSH, occupational safety health, has focused mainly on physical injury. However, recent development now recognize psychological hazards such as occupational stress, workplace harassment, and poor work-life balance as major risks to employee well-being and job performance. Psychological hazards in OSH are workplace conditions that cause mental stress, such as heavy workload, harassment, and poor work-life balance. Occupational stress occurs when employees cannot cope with job demands. Workplace harassment involves repeated negative action that affect mental health. This study focused on Malaysian civil servants and public university academic staff, guided by the OSS Act 1994 and Department of Occupational Safety and Health, DOSH. Guideline 2024. The findings show that unmanaged psychological hazard increase stress, reduce commitment, and raise employee turnover. Therefore, proper management of psychosocial risks is important for employee well-being and organizational effectiveness. In Malaysian public sector, employees often face heavy workload, strict performance targets, hierarchical management systems, and limited autonomy. These factors contribute to high level of stress and burnout. According to the Malay Mail in 2025, more than 40,000 civil servants are at high risk of mental illness, especially healthcare workers. Firstly, occupational stress occurs when job demand exceeds the employee's coping ability. Civil servants frequently deal with tight deadlines, staff shortage, frequent policy changes, and pressure to meet key performance indicators or KPI, leading to mental fatigue and reduced performance. Secondly, workplace harassment and bullying involve repeated behavior such as verbal abuse, excessive criticism, and intimidation due to hierarchical structure. Power imbalance may exist, especially in enforcement and frontline roles, which can lower moral and organizational commitment. Thirdly, poor work-life balance is common among shift-based workers such as police officers, nurses, and emergency staff. Long working hours, night shift, and mandatory overtime reduce rest time and negatively affect mental health. Psychological hazards significantly affect employee well-being and public service quality. Therefore, It is essential for public sector organizations to identify, assess, and manage psychosocial risks in accordance with the Occupational Safety and Health Act 1994 and the OHS guidelines to improve both employee welfare and organizational performance. Next, Siti Aisyah will continue with impact of psychological hazard on employee performance and well-being. Thank you.
Okay, thank you, Ms. Noor Aishadorin. Assalamualaikum, Madam Rafiza and everyone. My name is Siti Aisyah binti Adugani and I will continue with the impact of psychological hazard on employee performance and well-being. The impact of psychological hazard on employee performance and well-being can be many forms, from the work design, organization, and management, as well as their social context, which have the potential to cause psychological or the social harm. This hazard can be manifest in various forms, such as excessive workload and unrealistic deadline, to bullying, harassment. Poor relationship with colleagues and supervisors can be created a toxic work environment. Effect of mental and emotional health can be issue in the mental health issue, emotional distress, physical health, and unhealthy behavior. Mental health issue can be increase the risk of anxiety, depression, burnout, PTSD, sleeping disorder, and suicide ideal. Emotional distress can be negative mood change, emotional exhaustion, increased irritability, and social withdrawal. While the physical health can be stress-induced issues like headache, high blood pressure, cardiovascular disease, gastrointestinal problem, and musculoskeletal disorder. While finally, with the unhealthy behavior, higher rate of smoking, poor diet, substance abuse, and lack of exercise. While effect for the work performance, there is decreased productivity and output, like inefficiency, missed deadline, and low quality of work. While increase of absence, like more sick days, often take longer than time of leave. While presentation can be show up to work but unable to function effectively. While the high turnover, employees will live for the better environment and increase recruitment costs. While there can be lower moral and cohesion, negative impact can be bring to team spirit and collaboration will go decrease. While high injury rate can be psychological, unsafe workplace, and more injury. While organization level consequences are also can be very effective to the company and employee. For example, the financial cost, higher worker compensation claim, increased recruitment, training costs for turnover, lost productivity, and potential legal fees. While there are also productivity and efficiency, low overall output, poor quality work, and disruption to workflow. While workplace culture can be strained, team relationship, poor moral, lack of trust, reduced engagement, and negative overall environment. While reputation and legal risk can be damaged to the employee brand, difficult to attract talent, and potentially legal action for falling product provide safe workplace. Increased absenteeism and turnover. More sick day for an employee will live for healthier environment, great knowledge loss, and resources strain. There are few examples of situations in Malaysia public sector. These are a huge impact for psychological hazard on employee performance and well-being in Malaysia. The effect workplace influences relationship between job insecurity and psychological well-being among Malaysian precaution work. They also fill a gap in the research by explaining the causality associated between job insecurity and psychological well-being among precaution workers. As previous well-being study and have the largely focus on employees with secure job. The biggest example is COVID-19. During the pandemic, Malaysia government conduct a lockdown and especially affected the work system and employee for many aspects on the work psychological of the employee in Malaysia public sector. The issue can create a stress due to excessive workload. There are burnout and resignation. Public servants experience burnout, leading to decreased motivation and to the leaving their job, especially after intense period like pandemic. Health problems like increased anxiety, depression, cardiovascular risk, obesity, musculoskeletal issue, and linked to the chronic workout stress. They also have poor performance. Doctors find heavy workload in the hospital may see their job performance suffer and effective patient care. Work-life imbalance. Excessive demand on the time constraint dispute personal time, leading to stress and feeling lack of control. Red tape stress. It means like heavy combined with the bureaucratic rule that the red tape cause a further stress, reduce commitment as the work get delayed. They also have inequality, reduced staff shortage, and budgeting constraints amplify the workload that might it hard to make it demand. And also there are high turnover. Burnout and stress contribute to desire to quit. Regular eviction among the frontline workers during the COVID-19 pandemic.
Thank you, Siti Aisyah, for the explanation. Now it's my turn to explain about the responsibility for managing psychological hazard in the workplace. Psychological hazard are work-related factors that can negatively affect employees' mental health. For example, these include excessive workload, unclear job roles, poor communication, lack of support, and workplace bullying. If these hazards are not managed, they can lead to stress, burnout, and a reduced productivity at the workplace. Therefore, clear roles and responsibility are essential to manage psychological hazard effectively. Point number 1, this is a department head and supervisor responsibility. Department head and supervisor play a key role because they work closely with employees on a daily basis. Their responsibility include identify early signs of stress, such as fatigue, frequent mistake, or absenteeism. Point number 2, they are clearly explaining job roles, tasks, and deadlines, and they also can provide support and encourage employees to raise concerns. For example, if an employee is overwhelmed by workload, the supervisor may adjust priorities or reduce a task, and also can reduce the stress. The responsibility number 2 is under Human and Resource Management Division. The Human Resource Management Division supports psychological health through systems and policies. Your responsibility also include developing policies related to mental health and workplace well-being. Other than that, they can organize a training on stress management and communication skills. Lastly, they can provide access to support services such as counseling or employee assistance program. In my opinion, the other responsibility is Occupational Safety and Health Committee. JKKP ensures psychological hazards are managed as part of workplace safety. Your responsibilities include assessing psychological risks in the workplace, consulting employee and management on stress-related issues, and they also can monitoring complaint, incident, and feedback. For example, if a department report high stress level, JKKP may recommend change to workload or work process. Lastly, point number 4, the department that responsible to manage psychological hazard in the workplace is Public Service Department, JPA. JPA provide overall guidance for psychological health management in the public sector. Your responsibility must include issuing policies and guidelines on psychological well-being. They also must ensure consistent implementation across ministry and departments. Lastly, they can monitor and evaluating compliance. For example, JPA may require ministry to include psychological risk assessment in annual safety report. In the conclusion, managing psychological hazard requires cooperation at all levels of the organization. When supervisor, HRM, JKKP, and JPA fulfill their role effectively, a healthier, safer, and more productive workplace can be achieved. Psychological hazard also must have a direct, substantial, and a multidimensional impact on employee performance in the public sector. They affect productivity, engagement, attendance, workplace relationship, and organizational effectiveness for improving public sector performance. They also require strong leadership commitment, active involvement of the Occupational Safety and Health Committee, their policy, early intervention mechanism, employee participation, and supportive organizational culture. By prioritizing psychological well-being as an integral component of occupational safety and health, the public sector can enhance employee performance, strengthen the service delivery, and uphold public trust in government institutions. Thank you.